Has now infiltrated 11 countries around the world, and the number of cases in Canada has risen to 27. The World Health Organization has renamed the virus Influenza A and say this is just the beginning of a global outbreak. But so far, all but one of the 177 deaths reportedly caused by Influenza A remain in Mexico. By comparison, cases in Canada have been relatively mild.
With the WHO advising all countries get their health crisis plans in order, and with the specter of a full-blown pandemic in the offing, governments around the world are taking increasingly aggressive action.
All countries should immediately now activate their pandemic preparedness plans. Countries should remain on high alert.
The number of officially reported laboratory-confirmed cases of H1N1 to WHO have been 236 cases. This is up from 148 cases which were reported yesterday.
Here in the UK, the government has launched a public awareness campaign, including television commercials and a leaflet which will be sent to every Briton outlining the steps necessary to protect themselves from swine flu. Elsewhere, an increasing number of countries are targeting pork products, even though the WHO has said pork products are not responsible for spreading the disease. Egypt has gone as far as to order the slaughter of hundreds of thousands of pigs. There are increasing concerns that these kinds of extreme decisions could do more harm than good for a flu that has yet to prove itself overly virulent.
There is nothing to us which epidemiologically suggests today that we should be moving towards phase 6.
At least one emergency member of the WHO has said he is worried that the world will waste resources, including valuable antivirals, fighting a flu that ends up being relatively minor. It could leave the world vulnerable to something more serious in the future.